My name's Georgina and I'm an emergency medicine specialist, so I work in a public hospital emergency department. The public hospital system is really overburdened, so we have a lot of people on trolleys waiting to get to a bed on the ward. We have a lot of people with drug and alcohol problems, a lot of people with mental illness, and then we also have a lot of people with lifestyle related illnesses such as heart attacks, diabetes. A lot of our workload comes down in the end to how healthy people are in their environment. I'm at the end of the line, 100% in the acute healthcare perspective, which is really blowing out in terms of demand. It makes much more sense to put emphasis back into the preventative aspects and to stop people getting so unstable and so unwell that they need to access acute healthcare services.
My name is Boyd Swinburne and I'm Alpha Deakin Professor at Deakin University. My research is in obesity prevention. In fact, we established the World Health Organization Collaborating Centre for Obesity Prevention. Childhood obesity is one of the greatest threats facing Australian children these days. 1 in 4 of them is overweight and obese, and we know the likelihood of that tracking into adulthood is very high. If we don't do something about preventing obesity, then we're going to continue to see that rise in diabetes and its effect on cancers and cardiovascular disease and so on. Prevention is always the best bang for the dollar across a whole number of spheres in mental health, alcohol, tobacco, obesity and so on. Less than 2% of the health budget ends up in doing preventative action, and most of that is in infectious diseases and in screening programs. Hardly any of it is in promoting healthy eating and physical activity.
My name's Karen Sims and I'm the manager of the Parents Jury. Ever since I've had children, which is almost 13 years now, I was very interested in giving my children a childhood where they ate healthily and exercised regularly. I was surprised by the junk food that's on offer to children. It's everywhere they go. We have an obligation to make sure our children aren't exposed to too much junk food advertising. But the two major things that governments can do is regulate the advertising industry and control how much food marketing to children takes place, and governments can also introduce the traffic light labelling system so parents can decide with much more ease and confidence that what they're buying for their children is healthy.
The Greens know that if all Victorians are to live a full and healthy life, then our health system must focus on more than just end-of-the-road hospital treatment. In order to do this, we have a wide range of health initiatives with a greater emphasis on preventative health. These include more needs-based access to healthcare professionals like psychologists and dietitians, a publicly funded dental care scheme, and stricter regulations on junk food advertising and food labelling. To find out more, please visit vic.greens.org.au.